Talk to me about the COVID death classification, because from the data we see from your former employer, the ONS and Public Health England, it's a death that someone has also tested positive for COVID in the last 28 days. I mean, from a statistics point of view, is that even a good metric to look at? Because as far as I can understand, that includes a car accident, a suicide, anything with that positive test. Is that not flawed by nature to a certain extent to make that based on policy?
So that's kind of where you go back to where we talked at the start of the interview, the excess deaths. So London, for example, at the moment, we are seeing increasing deaths from people with COVID, but we're not seeing increasing number of deaths for the time of year, similarly in the southeast. So people are dying more now than, say, a month ago in those areas with COVID, but the overall deaths aren't over. So that may indicate that some of the people who are included in the statistics may have sadly died anyway. Because one thing we do know, obviously, is that people die every week of the year from different causes. So bringing us back to the excess deaths for the north, we are clearly seeing that the deaths in the north of England are above what you'd expect for the time of year. So if you base your metric on that and your policy around the excess deaths, you can clearly see that COVID is causing more deaths than you would expect in some parts of the country versus another. So maybe looking at overall the total number of deaths, if they're COVID or not, and you do get people who might think, oh, well, that's misleading because, yeah, what if they might have died anyway, or they've tested positive for COVID, but they didn't die of COVID? That is why I bring everybody always back to the excess deaths. If they're above what you would expect, we know that there's something going on in the country, COVID probably at the moment, that is causing deaths to be over and above what you would expect.
Right. But Jamie, nobody's talking about that number. That's what boggles my mind. The media doesn't, the Guardian daily reports, the New York Times. I haven't heard Patrick Vallance or Whitty or Johnson once say excess deaths. They base it all on the other numbers they throw out that seems to me to be the numbers that are convenient with the policies they want to interact. I mean, do you not see that too?
Well, I in sympathy with Chris Whitty, he always talked about excess deaths during the first part of the pandemic. It was one of the things that they actually were saying, ultimately, it's the excess deaths that we need to look at. I think over maybe the last 6 weeks, it's only because it's the last couple of weeks, because of the time lag, it's only the last couple of weeks we've started seeing the excess deaths rise. So it probably wouldn't surprise me if the presentations over the next few weeks do focus on that. But if you do, as I said, show all the different parts of England and Wales and Scotland and Northern Ireland, you do see that regional variation. So maybe you would say, if you've got this regional variation, should we have the same restrictions? And I think that's going to be the question for post-December, when the national lockdown, say in England, comes. Do we go back for a regional approach? But it's important for the public to buy into what the kind of approach are, because ultimately the virus can't spread if people are kind of practicing social distancing and trying to go about their daily lives as they are. The virus can't spread. But we clearly know that the Northwest, we had a little bit of an improvement. It's come down, the hospital admissions, but deaths are significantly above. They're about a third higher at the moment than what you'd expect for the time of year, which is quite significant in regards to all of that. Wales is similar, and the Northeast and Yorkshire isn't far behind. And it's ironically, it's where the hospital admissions are the highest, is where we're seeing the highest number of deaths. But you are right, you probably will have people in these statistics who have tested positive for COVID, who have died over the last, say, 28 days, but not necessarily it was COVID that killed them. So I say I'll bring it always back to looking at the excess deaths.